Healing acronyms and how to use these acronyms alongside sports massage. This online learning follows on from the stages of healing and looks at different things that we can do as sports massage therapists along that stages of healing process to help our client through a soft tissue injury. We use acronyms to help us remember which stage and what we need to do with each one. So let's go ahead and we'll discuss them. What we will cover. We're going to look at the revision of healing acronyms that we covered in level 3, which is the RICE and POLICE acronym. We're going to discuss some other acronyms that may be used instead that may be slightly forward thinking from the old RICE and POLICE processes. We'll look at the science behind them and the impact on improving soft tissue injuries following that protocol. And then we'll look at how sports massage can play a part in working alongside those healing acronyms, or how those healing acronyms can work alongside the treatments that we provide as a level 4 sports massage therapist. So just to recap, we focused on the RISE and POLICE acronyms within your level 3 sports massage. And prior to RISE, there was also ICE as well, which took out the rest part of the RICE acronym. These acronyms are widely used, but the evidence behind them is quite limited, and it really only focuses on acute soft tissue injuries, where as sports massage therapists, we may see more chronic and persistent pain issues rather than acute soft tissue injuries. The acronym we're going to focus on within this online learning is something that was discussed quite highly within the British Medical Journal, and we feel that it really encompasses everything about a client's healing rather than just what happens in the acute phase of a soft tissue injury. But before we go into that, there is just one other acronym we want to discuss, which is to be focused on the first 72 hours after injury. Do no harm is the first acronym we're going to discuss in this online learning, and this is a protocol to follow within the first 72 hours of an acute injury. And the main reason is to avoid opening up any blood vessels and increasing the bleeding or blood flow to this particular area of injury. Heat and alcohol will both open up the blood vessels and create more blood flow to the area of injury. Re-injuring, again, it creates a secondary tissue trauma which you're trying to avoid. And also massage can work similarly to heat, where it creates more bleeding to an area. During the bleeding phase of injury, the body is creating its own inflammatory response to help the healing process, and we don't want to impair or negatively impact that process by adding any of these into the mix. And when you're working with your client, it's really important that you educate them on each of those things. Especially there was lots of misinformation out there when it comes to heat and massage in particular about injuries. Alcohol, I think that's an important one to discuss with your client, especially if you've been working or massaging at a sporting event, because chances are at the end of those big events there's often alcohol available, and it's important that they avoid that if they have experienced that soft tissue injury and explain why they need to be avoiding that. Peace and love is a new acronym we're going to be focused on in this online learning, and it was discussed in the British Journal of Sports Medicine as a new way of supporting clients through soft tissue injuries. Peace focuses on the early management of an acute soft tissue injury, and after those first few days have passed, as the inflammation starts to decrease, then we want to focus on love, and that's for a later management of a soft tissue injury. So we're going to break each of them down individually a little bit further and how it relates to us as sports massage therapists. P is for protect, and this is about unloading and restricting movement for the first 1 to 3 days to minimize bleeding. So this works hand in hand with the do no harm acronym. Your client wants adequate rest, but too much rest can impair healing, so it's important that they rest for those first few days before we head into the love phase. E is for elevate. Now, elevate was in the ICE and the POLICE acronyms as a way of helping improving, reducing interstitial fluid out of the injured area by elevating the limb. The evidence behind it is quite low, but it's still recommended as it's quite a low risk modality, and I think it also encourages clients to create some adequate rest after a soft tissue injury, so it kind of links in with the protection element as well. A is for avoiding anti-inflammatories, as anti-inflammatories can be really detrimental for long-term tissue healing. As we discussed in the phases of tissue healing online learning, Anti-inflammatories such as opioids can actually create a different set point for that inflammatory marker, creating more pro-inflammatory molecules, which you're trying to avoid. And it doesn't help the healing process of a healthy person. So you want to inflammation is a completely normal and essential part of a tissue healing process after an injury, and adding anti-inflammatories into the mix can really impair that healing process in your clients. Some have suggested that using cryotherapy at this stage may also help. The evidence behind it is lacking, however, but it may have an analgesic effect for the client if the client has been experiencing increasing amount of pain. If you do suggest using cryotherapy to your clients, then ensure they're educated about the length of time they should be using ice in a particular area, as it may impact the healing process by reducing blood flow to the area. C is for compression. Now, there are some conflicting studies on using bandaging for a early management of an injury, but some research suggests that it may limit intra-articular edema, so edema within the tissues. Other options in this area that may be less compressive is using something like kinesiology taping for edema if you are qualified to apply this type of taping. And E is for education. Now, this is really important. Education is the key to help support your client through management of a soft tissue injury. Talk to your clients about what may be happening for them is really simple and an easy way for them to understand how to help themselves get better. Use easy to follow language and discuss the benefits of having an active approach rather than a passive approach to treatment. And this will definitely help their healing process. So ensure you give yourself time in treatments to educate your clients, and it becomes more an active, participated treatment rather than a passive modality. Education for the client can also be a big factor in pain reduction and how your client perceives pain. If they know what they're going through is common, it's a healing process, then that can often have a really good positive impact on the pain that they may be experiencing, which again leads them to be more motivated to focus on an active approach to treatment rather than a passive approach. And next we'll head into focusing on love. After education comes load, and L in the love section is load. Optimal loading without creating a pain response promotes repair. It helps remodel and build tissue tolerance. If you think about Wolff's Law, looking at bone remodeling and potentially collagen remodeling, it also improves pain tolerance as well, and changes the level of pain that your clients may experience. If we think back to the pain module in level 3 sports massage, and we discuss about using massage to calm the system down and then building up with movement, this is where this is really important after a soft tissue injury in the subacute and then phases beyond that. So loading is important. It is also about finding the types of exercises and movements that your client will enjoy, because that's more likely going to get them to adhere to the exercises than something they don't enjoy and don't like. Going back to the study by Henry AL, which was discussed in the level 3 sports massage, 1 to 3 exercise prescription is optimal for a client to adhere to. So be specific with your exercise prescription. And if this is not an area of expertise, then work with a strength and conditioning coach, personal trainer to help them through this phase. O is for optimism. Now, this is really important when you're working with your clients. And the language that you use when you're discussing their injury and what's happening for them can really make a difference on the healing process, how they perceive pain, and how they feel about themselves during this phase. We discuss this a lot more in the psychology module later on in the online learning. But for now, I want you to really think about how you can help your client through this phase of a soft tissue injury. Think about the words that you use, the education that you can support your client with to help them understand and be accountable for their recovery as much as you can facilitate them during this process. And all of those things will go hand in hand to promote a positive outcome for an injury recovery. V is for vascularization. We should be recommending cardiovascular exercise to all of our clients, but what we know is that cardiovascular exercise done in a pain-free setting and started early can help improve blood flow to the injured tissues, which helps the injury healing process. Not only that, it will have a huge positive effect on the client's motivation, optimism, if they are able to start doing some exercise again that they really enjoy. If you've had an injury yourself and you know how it feels when you go back into exercise again, it may be at a lower level, but when you start exercising again, it really makes a difference in how you feel and the positive feelings that you experience when you know that you are in the process of healing after an injury. So it can really help your client's motivation and to continue that active approach to healing. And E is for exercise, which links directly into everything we've discussed. Exercise is key for optimal loading of the tissues and supporting the client to resume to normal activities and sport, which is often their main goals. It will help restore mobility, strength, and the proprioception early after an injury. So it's really important that you get your client back exercising as quickly as possible. If you aren't an expert or qualified in exercise prescription, then once you've given your home care to your clients, liaise with a strength and conditioning coach, a personal trainer, a sports therapist to help them work with your clients to get the exercise that they need to help restore movement, build strength, which will have a positive impact on their injury recovery. Once you understand the acronyms, you want to now focus on how you can implement it easily into your sports massage practice. Always start with your client screening form. Get as much information about them as you possibly can before you see them for treatment. Use the injury assessments to screen for potential injuries that may be happening. This will give you a good idea of where to focus your treatment thereafter. And when it comes to the actual massage application, follow the acute massage protocols for the specific injuries. And in the injury section in this online learning, there are videos and protocols for each type of injury that you may see in your clinic. And you utilize those alongside using PEACE. If in doubt, always refer on to a clinician that can provide a clinical diagnosis of what may be happening. And importantly, education is key to helping your client with their injury recovery. When focusing on the LOVE acronym within your sports massage practice, focus on the specific protocols for each type of injury that's in the injury section in the online learning, and use massage strategies such as muscle energy techniques and soft tissue release that can help improve range of movement and proprioception at the joints. Recommend a detailed home care plan for optimal loading, or work with someone that can provide this for your client. Suggest pain-free cardiovascular exercise that they enjoy, and communicate with your clients in a simple and clear way to help with tissue healing education. And here are the references that were used for this online learning. So for further reading, please head over to these links.